Private practice is booming at the moment. We're seeing year-on-year increases in demand for private practice, which is great for the industry as a whole, and does mean that we need to think about optimising the treatment of patients so that they're flowing efficiently through the system. Care Pathways is a great new development within the ePractice system that's going to help people do that. So essentially it means that you can have a structured treatment plan, and the system will go through and ask you specific questions to ultimately lead to a diagnosis and a treatment suggestion. So having Care Pathways set up on the system helps you maintain a consistent approach to how you're seeing the patients. This helps with CQC or other regulatory bodies if they come and investigate yourself or see how you work, although they do focus a bit on communication with the patient and individualised care. So with the treatment pathways, it's great because it gives you that consistent approach, but you can adapt those on a case-by-case basis and record why you've adapted it to keep that audit trail.
I think the key to the Care Pathways is standardisation, both from what the practitioner is going through with the patient at the end of the consultation, but also what's recorded in that patient clinical notes. This is particularly useful if you're expanding your clinical practice, bringing on new practitioners. You can use the pathways to ensure that all the information they're capturing is as per your practice processes, and everything gets recorded in the same manner for every patient, regardless of what practitioner they see. I think the outcomes is really important. You can record based on the patient's diagnosis and other factors what their outcome is, so you can predict a pathways for a particular group of patients that have got the same condition.
By creating Care Pathways, you're standardising certain journeys for certain treatments. And by using those standardised protocols, although each patient is an individual, you've got a flow that works across the board. So even though you're tailoring, you are still using that strong starting point. Then if you make changes, it's done for a purpose, not just as a whim. The other great thing about Care Pathways is that if you've got multiple practitioners working out of your practice, you can be sure that everybody is singing from the same hymn sheet, should we say, and all your patients are getting that consistency regardless of who they're seeing.